The steering committee and the board of directors of St. Jude Hospital paid a strategic and significant visit to the St. Jude Hospital Reconstruction Project in Augier, Vieux Fort, to get an update on the progress of works since the commencement of the rehabilitation of the site on November 1st, 2022. Committee members received an update from representatives of the contractor, Construction and Industrial Equipment Limited. This project, which aims to modernize and rebuild the facility, is making great progress with key areas near completion.
We've observed, for example, that we do now have capacity at that new facility. We would have capacity for neonatal care, which is something that we do not currently offer at the George Odlum Stadium. So, where you have intensive neonatal care requirements, those cases would need to be transferred to Millennium Heights Medical Complex. We would now have the ability for us to provide that service in the South. Increased capacity in terms of increased bed space, but we also have significant improvements in surgical, especially our operating room, with two operating room theaters, an additional operating room theater on maternity, and now capacity for us to be able to improve the quality of care that we and the scope of the services that we can now provide to the persons in the South.
The physiotherapy and dialysis wings, which are among the most critical components of the hospital's new infrastructure, are nearing their final stages of construction. These areas are expected to be completed in the coming months, marking a significant milestone for the project. Work is also underway in the west, east, and surgical wings, which are expected to transform the hospital into a state of the art facility. These sections are being developed to accommodate expanded patient capacity and improve the quality of healthcare delivery across St. Lucia.
We can expect changes to the overall efficiency of our operations, and that's because we've started the process of process reengineering, redesigning at the George Odlum Stadium to map it against the changes here to the infrastructure at Augier to ensure that we are able to um, improve the quality of care and the quality of service that we provide to patients, but most importantly as well that we are able to do so in a manner that meets international standards. And so I would want to remind the public that we would have visited this site in February of this year with Accreditation Canada and done the initial walkthrough. And I'm pleased to see that in the number of improvements that they had recommended, that those have been taken into consideration and implemented by the contractor.
The completed hospital will provide state-of-the-art medical services to the community, improving patient care and access to essential healthcare services in the southern part of the island.
Works have been advancing very well on those additional buildings, including components such as the electrical works, exterior works, parking lots, the roads, etc., etc. And we've done significant works on those components of the project.
Construction and Industrial Equipment Limited, the contractor overseeing the reconstruction, expressed confidence in completing the project on schedule. In a previous interview, the company's management reiterated their commitment to the project, with Reno Gujada stating, quote, "Whatever I start, I finish," end quote. This statement, reflecting the contractor's determination, has reassured local stakeholders and health authorities about the timely completion of the project. Vinny Kulkarni is the project supervisor for CIE Limited. Kulkarni echoed the optimistic sentiments of Gajada.
We have done a lot certain improvements in terms of the modern equipments which can be facilitated to get uh, to the end user, and we also have spaces which we have utilized for the maximum benefit of the hospital. We are going very good. In fact, there's a lot of progress for last 3 months now, and we had some major challenges, but we have come over with those challenges. So we are going very well.
Caribbean Consultancy Engineering Limited is currently engaged as the consultants for Phase 1 and 2 of the project. As project manager, CCE Limited ensures all designs are accurate and meet standards set by the client, the Government of St. Lucia. CCE also oversees all aspects of the construction process. Project manager for CCE says transparency, frequent meetings, and engagement is a crucial component for the expedient and adequate delivery of the hospital.
The project is split into two phases. So the first phase is coming to a completion. This is the completion of 4 buildings, which the contractor needs to complete as per his contract. The second phase has been recently awarded as of October, with the contractors also moving along. That's the part where we are in a joint venture with our partner consultants, and they are progressing well on that as well. So we have some close off to do of the first part of their contract. I think the ministry would like some partial handover, but that is in talks. But that will be in its 90% currently, and the rest of the facility is about 50-something%, and the contractor is progressing well.
The St. Jude Hospital Reconstruction Project is expected to significantly enhance healthcare services in the southern region of St. Lucia, providing more comprehensive and modern facilities to meet the needs of the growing population. The site visit allowed members of the steering committee and board of directors to gain first-hand insight into the progress and to ensure that the project continues to meet its objectives and timelines. With the contractor's confidence and the project's momentum, the St. Jude Hospital Reconstruction Project remains a cornerstone of St. Lucia's healthcare development, with the promise of improved healthcare services on the horizon. Jade Brown, St. Jude Hospital Reconstruction Project.